Welcome back. The province says it's taking action to strengthen mental health learning in Ontario schools. It's introducing mandatory resources on mental health literacy for teachers and students in grades 7 and 8. For more on this, we're joined by Education Minister Stephen Lecce and MPP for Burlington, Natalie Pierre. Thanks for joining. Natalie, let's talk about you first. This is a personal touch for you with your sons living with mental health struggles. Do you want to delve a little bit more about that?
Sure.
As his mom?
Yeah, so about 5 years ago, my son actually took his own life.
Okay.
He was 17 years old, and we didn't really, there was no signs or symptoms that he was struggling. He was an ordinary teenager. The day before he died, he had taken a university tour, worked a couple of hours at his part-time job, and hung out with his friends. And the night before that, he'd actually been to the high school dance. So it's just one of those things where we don't know as parents, we don't always know what's going on with our kids.
And we always hear about that there was never any signs. There was nothing we could have known to help. And is that what propelled you to get into political life or to pursue what we're talking about right now in this mental health literacy?
So one of the things that followed after Mike died was the number of people who came forward to share their experiences and their struggles with their own mental health. A lot of the people that I spoke to, it was the first time that they'd ever shared their experiences. They'd struggled in silence. And these were friends, family, co-workers, teachers, lawyers who came forward to share their story. And I just thought, there's something I can do to fix this. Right. And so back in 2019, I started a bit of a mini campaign to advocate for change, to have mental health literacy introduced into the school curriculum in a very direct and intentional way. So I wrote letters, I sent emails, I made phone calls, and one evening received a phone call from Minister Lecce. I was pretty surprised, but it was a call to participate in an announcement where our government was doubling the amount of funding for mental health supports in schools. And since that time, I'm happy to say that we're here today celebrating some fantastic news. Yeah,
do you want to talk more about that? We talk about math literacy, we're definitely trying to work on that. Mental health literacy seems to be a new term. It was the first time I heard it today, and like you mentioned, unfortunately, and what a lot of people talk about, we just don't know how to deal with it, how to recognize, how to deal when we do feel that, oh, you know what, I check a lot of these boxes, let alone parents. I'm a new parent. I don't even know. I worry about these kind of things. And now for students to try to target this themselves, to realize, you know what, they're not alone. So how important is this? And let's map out what this means, like this mental health literacy that you're launching here.
Yeah, so Natalie, is being very humble. We wouldn't be here today if it wasn't for her leadership as a citizen, private citizen, as a mother, and as an advocate. And then as an MPP, introduced a motion supported by all parties calling for the government to step up mental health knowledge in the curriculum and funding and supports. So today is a good day because there's some light in the darkness. And we want young people to know that there's hope, that there are supports, that there's a great deal of love out there for these kids. And that experience, I think, was moving. It moved us to do more. And so while we have the most progressive mental health curriculum in the country, we were the first in the country. Today's a recognition there are gaps. We've got to do more. So yeah, we are going to be requiring grade 7 and 8 students to take mandatory learning, part of Natalie's vision, not just in elementary, also in high school too. Grade 10 kids in careers course, linking pressures and stress and angst, the day-to-day life skills of managing that in a work environment, especially as young people in grade 10 start to give thought to their higher learning, if they're going to go to university or college or the skilled trades. So we're trying to create a toolbox of realistic skills they could use in their lives. That was the vision. The other element we heard is there's a lot of kids in summers where, the school system, the services stop in June. That means those families have to scramble for supports for their kids for July and August. That's ridiculous. Frankly, it's just unacceptable. So we thought, okay, how can we make life better for these kids and these families? Part of the idea was let's annualize or create year-round access to mental health within schools. And I'm so happy that this announcement is $12 million for this summer, $14 million for next summer, $16 million for the year after, scaling up to create a sense of consistency in access. and just try to make the kids know that it's okay to not be okay. And I think what I heard from Natalie is this desire for the kids to know exactly where to turn to if they face difficulty too.
Right. And so, there was just a study that we've been reading about all morning talking about how almost 90% of Canadians think that we're in a mental health crisis right now, especially after the pandemic crisis, the COVID crisis, if you want to call it that, and to have universal mental health care. And I see there's going to be counselors, it seems like, in schools to help kids. What if they want individual help outside of school? Like, is there a future that you see where something like talking to a psychologist or someone could be covered by OHIP or something?
Well, I do know that Minister Tibolo,
Right.
he announced a 5% increase in pediatric mental health supports. That is a massive increase that's going to help us provide direct care to parents and children. The other thing that the government has done, which to your point is, because some kids will access supports in schools, some in the community, some both. We have to make sure both systems are integrated with part of a roadmap to wellness, where we don't have silos between education and health. So we launched a consultation this past year, first time our ministries did it together to create a more seamless experience. So to your point, we launched over 18 youth wellness hubs in communities across Ontario that provide integrated access. You can go into one space and get access to a psychologist or a social worker or mental health counselor. That's huge. I mean, that creates a one-stop shop of care. So we are trying to think big, provide more publicly funded supports and services. But today, in our school system at least, I can tell you, we've increased funding by over 550% from when we started, when the government was first elected in 2018. And this is not a political comment, but under the former Liberals, we were spending about $18 million in the final year under Premier Wynne. Today we're spending $114 million, and next year we're going to spend more, as I mentioned. So my point is, we know we got to keep going. We know the needs are rising, and I just want families to know that because of Natalie's leadership and the Premier's commitment and the funding, we're going to be there for our kids.
All right, Minister Lecce and BB from Burlington, Natalie Pierre, thanks so much. Thanks for your courage as well coming on here. I'm sure your son will be very proud. We appreciate it very much.